Good afternoon, everybody. Thank you very much for joining. We're just going to let the lobby settle down for a few seconds, if that's okay. There's quite a few people just coming in at the moment. We want to try and just give a couple of moments before the beeps hopefully stop. So we'll just give it another sort of 30 seconds before we start, if that's okay. There we go. Right, if it's possible, can I ask you all to keep your mics on mute? That would be great. And I'm going to kick off. So if I can just ask you to keep it on the log, that would be great. Thank you very much. So good afternoon, everybody. My name's Richard Ayres and I'm a social care advisor at Care England. And I want to welcome you to our joint Sona and Care England webinar, which is designed to help providers to really understand how AI, artificial intelligence, and automation are impacting our day-to-day operations in social care, as well as the ways in which we can integrate AI into our systems while maintaining compliance, and to hopefully, through the experience and knowledge of Ben, who's going to talk shortly, dispel some of those myths around common themes and concerns that people have around artificial intelligence and what it can and can't do specifically. And then we'll also help you with hopefully some real world examples of how providers are using AI in care. And I'm shortly going to introduce my colleagues on the call today to introduce themselves, but I want to do a little bit of housekeeping first, if that's okay. So I will, as I said, ask you to keep yourselves muted during the presentation. That's really helpful because we are recording the event, and if we can make sure you're muted, that will mean we get no little interjections. We are recording the session and we will share that session. So could I just ask you to mute people who aren't muted, please? We will be recording the session and our intention is, as always, to share any unanswered questions afterwards within sort of 24 to 48 hours of the event, depending on the questions that have been raised and our panel's ability to answer them. And we'll share any contact details of those of our panel members who wish to be contacted afterwards, should you wish to reach out directly. And I will ask our panel to share their experiences with us, and I will ask them to introduce themselves in a second. But before we do so, if you please use the chat function. If you've got any questions that come up during the session itself, please do pop them into the chat. And we will try and pick up as many questions and answer them as we go. And we are going to save sort of 10 minutes or so at the end for questions as well. So without further ado, I'm going to start with Ben and ask Ben, would you like to introduce yourself, please?
Hey, thank you. Super excited to be here. So I'm Ben. I'm one of the founders of Sona and the CTO. I've spent the last sort of 15 years or so building technology companies, and the last 10 of that focused exclusively on how do you bring really great technology to frontline workers. And so the last few years have been very exciting because AI has sort of unlocked a bunch of things that we've wanted to do for a long time that haven't been possible. So very excited for the conversation today.
Super, thank you very much. And Susan, would you like to introduce yourself, please?
Yes, thank you. Good afternoon, everyone. My name's Sue Weller, here from Greensleeves Care. My role is IT and Digital Transformation Director. I have many years' experience within the sector, and I'm privileged to lead on the digital transformation and exploring technology here at Greensleeves and within other care organisations.
Fantastic. And finally, Steve, would you like to introduce yourself?
Yeah, thanks, Richard. Hi, my name's Steve Bowler. I'm the DT Implementation Manager for Greensleeves Care Trust, and been in care now. It's very much my second career, and came out the RAF, and I've now been in care for over 15 years. So I'm the one that's for Greensleeves that's rolling out any new tech, whether it be care management, staff management, whatever it might be. And so, yeah, hopefully I can share some of my experience.
Fantastic, thank you. I'm sure you can. So from my perspective, AI has become a real buzzword recently, but we really want to try and understand what that means for social care providers today. And I think from Care England's kind of point of view, we're seeing AI used to create a lot of efficiencies, from sort of note taking in meetings, notes to support setting up care plans, and also AI to look at large amounts of data and process it quickly, and turn out reports and data in context of the data that's presented in front of it far quicker and far more comprehensively than the human eye can possibly do. we've used artificial intelligence in one of our own products called Smart Care Intel, which is a portal that looks at 100,000 sort of CQC reports, NICE guidelines, NHS best practice, health and safety exec information, and we can ask it questions and get that information back very quickly, and much quicker than someone reading 100,000 CQC reports can do. So it really does have some great benefits there. And I think, you know, we've seen many of our partners using artificial intelligence at sort of like the back end of some of their services, to see how it can help expedite and enrich their solutions. So I'm talking very much the Sonas of this world and the supporter members who we work with. And I think, you know, it's an incredibly exciting space, and the next 6 months is going to be a very significant, we're going to see a very significant shift across our sector as different AIs start to kind of talk to disparate systems, meaning integrations are maybe less necessary than they would have been previously. And I'm a relative newbie to AI, but I'm learning very fast. And someone far more experienced than myself is Ben from Sona. So I think probably best to ask Ben a question from a tech provider's perspective. What are we really where are we really at with artificial intelligence in social care, and what's the hype and what's actually happening?
Yeah, I think it's like AI is this really interesting term, right? Because on the one hand, everyone's talking about how new it is, and this new thing is AI, but it's also a term that's been being used for sort of 30, 40 years. And I read a great quote the other day that was, AI is what we call it when it feels like magic that a computer is doing something. And then when we get used to a computer doing it, we rename it machine learning and move on to the next thing. And so you end up with this like quite confusing landscape where you're like, well, what's the new thing and what's the older thing? And I think a really helpful mental model is to break it into like one thing that is machine learning, one thing that is generative AI, and one thing that is agentic AI. And sort of traditional machine learning is this very powerful thing that's very good at taking lots of numbers and generating other numbers off the back of it. So if you've got something that sort of forecasts for you, or does something where the output is a graph that tries to say something about the future, that's probably machine learning. And it's really powerful, but it's very rigid. If the underlying information that you want to put into it changes, it can't really adapt to that. And then a few years back, these things, large language models, of which ChatGPT was the first one, came along. And what that could do was it could work with words as well as numbers. It could sit over. So CQC reports are a wonderful example. Traditional machine learning, all CQC reports look a bit different. So machine learning can't really deal with it. But generative AI can sit over it and understand what's in it and do things with that information. And it can sort of ask questions and synthesize sentences off the back of that. And then the newest thing, I think that's like really only been possible since sort of April of 2025, so sort of a few months ago, is this thing agentic AI. And agentic AI is taking these large language models, these things that can sort of work with both words and numbers, and using that to create something that can go away, and when given an objective, it can go out and make a plan for itself and work out like, how might I get to that objective? It can go and start working through that plan, and it can evaluate how's that plan going as it goes along, and then make changes to its plan to try and get that to that objective. So for example, it can go out and look at a CQC report when asked to do something. It can look at that CQC report and say, oh, that CQC report mentions these things. I'm going to go into our BI tool and look up those things as they relate to us. And then I'm going to combine that together, and I'm going to go and try and do something else. So rather than you move from sort of having to tell a computer exactly how to do a task, which is what you do in sort of traditional machine learning, to telling the computer, this is the outcome I want you to get to. I want you to achieve this, or I want you to find this out for me, and allowing it to go and work out what's the best way to get there. And that's where I think we have these crazy efficiency opportunities over the next sort of 6 to 12 months, because there's an element of traditional machine learning and dashboards sometimes felt like they actually made more work for us. Like we got all of this data, but you got 20 dashboards you were meant to go and look at every day. And what this can do is interpret that for you and say, I've looked at those 20 dashboards for you. Here are the 5 things you need to be aware of. So it can actually start to take work off our plates rather than put more work onto it.
Fantastic. And that's agentic AI. I mean, it really is the thing of the future, isn't it? It's what we've all, growing up, seen on sort of TV, and it's actually here now. It's such an exciting time, and it's happening so quickly. Thank you, Ben, for that. And I know, Sue, I was going to come to you, just in terms of Greensleeves having a reputation for being, really thoughtful within innovation, and a real leader. Is, what first sparked your interest in exploring technology within Greensleeves? Oh, I think we might have lost Sue. Oh, Sue, we've got you back.
Okay.
There we go. Yeah, we got you back. Sorry, we lost you there.
That's okay. The digital transformation strategy here at Greensleeves is driven by several factors, and I'm sure that there's lots of people on this call that can resonate to these factors. The main change and challenges was the transition from paper-based records to digital systems. To be able to provide us with improved efficiencies, enhanced security and access to real-time information, which we didn't have at that point in time, to replace the use of spreadsheets for reporting. Potential human error leads to inaccurate data, as we know, flawed conclusions, poor visual and controls, and duplicate effort and time. So the order of priorities was very much around replacing our on-prem applications with cloud-based solutions and replacing end-of-life applications which were no longer supported. It was a very the actual digital transformation was very full on as such, due to the high priorities that we were coping with. I think one of the ones that we did sort of not fail on, but didn't give it enough time to look at and to consider the risk, was the IT infrastructure to support digital transformation. I think there is a knowledge out there that the infrastructure's in place and that will work, and it's just literally implementing systems. It doesn't work like that. We did suffer connectivity issues within a number of homes and had to integrate the IT infrastructure upgrade as part of that digital transformation. And obviously to ensure that we retain our competitive edge by introducing a programme of key projects that they delivered the best use of technology. And I'm really pleased about our selection of those technology systems, because it's really working well for us. We've been on a very aggressive journey, which is fulfilling our requirements.
I think that's interesting when you talk about spreadsheets, because I remember my time in practice, and I felt that we had a whole sector built on spreadsheets. That's what our data was telling us, and it's really the last couple of years we've started to see more kind of digital data and records. And as Ben said earlier, we've now got lots of data in lots of systems. What do we do with it all? It's 12 different dashboards to look at. But you did talk about the IT infrastructure. I think that's really, really important, because for some of the larger providers, then you might have a different type of digital infrastructure in place than some of those smaller SME mom and pop type services that are maybe relying on third parties to provide that digital infrastructure. And again, we've got the digital switchover coming in 2027, when those analog lines are being unplugged. So there's an awful lot to think about on that. And the last thing you said there, which really kind of resonated, was about connectivity. Everything's Wi-Fi and Bluetooth these days, isn't it? And actually,
exactly.
if you haven't got the connectivity right in your servers, and you've got those pockets where it's not reaching, that's a huge issue. And it's not just as simple as popping a booster in. Sometimes you need extra capacity in lines, and we've seen even AWS yesterday going down. Connectivity is a huge issue. I think maybe coming on to Steve now. So you've spent a number of years rolling out tech within care. What are some of the areas that have really surprised you about kind of the process or the impact it has on the organisations?
I guess the biggest surprise, Richard, has been the sort of ripple effect of digital transformation beyond operational efficiency. And I've found that if you implement a system in the right way, it can not only help to empower staff, but it can improve morale and even shift organisational thinking towards more proactive, data-informed care. I guess much of what we do with current implementations involves an immense amount of data entry, predominantly by those frontline staff who, as we know, are already incredibly busy managing their own roles with any care environment. And moving forward, at Greensleeves, we're going to be looking at AI solutions to try and ease as much of this burden as possible to make that transition to new tech a little smoother and more seamless, ultimately freeing up staff to spend more time focusing on what they should be focusing on, which is their primary roles. And the other side that we get with implementation is the sheer amount of data that bringing a new system delivers outwardly. And then it's obviously down to how efficiently we manage all of this information. Within our care management system that we've recently implemented, we've spent a lot of time creating our own library of audits so that we can improve quality within the homes and enhance compliance. Coupled with this, we're now in the process of implementing their analytics tool to help us mine all of this data, which will not only help us to produce automated documentation and factual summaries, but actually allow for these reports to be sent to home managers in their inbox, as opposed to, as you've already mentioned, the current process of going to 15 dashboards to find out what they need. And we're also bringing on Sona metrics, which we use on our TNA system here at Greensleeves, and it will not only give the home staff a clearer view of rostered hours, contracted hours and cost of hours against the home budget, and that's all plainly displayed on screen every time they log in. But importantly, it'll enable us to extract all of this information through Power BI initially and create a trust-wide dashboard, which in essence will give us a great picture of where each home is with staffing and rostering, and better improve efficiencies and help us to target any staffing shortfalls in as timely a manner as possible.
Yeah, that's really interesting. I mean, the ripple. I like the idea of the ripple effect of, a change in one area can make lots of other changes in other areas as well. I think where it's adding value and improving staff morale and empowering staff, that's really, really positive. I think there's another side to that, where we've got a large part of our workforce that hasn't grown up with technology, that might equally be a little bit skittled by some of those changes. And we've got to take them on a journey, and that's something we have to acknowledge, isn't it?
Absolutely.
But I do like that bit around the automation and getting, away from the dashboards into an email that comes in and says, here's your top 5 things, like Ben said earlier, you kind of need to focus on. But you did talk about that time and attendance system, and I think that's important. We've got the Employment Rights Bill coming, and of course there's going to be changes in 27, which means that even our guaranteed hours that we give our staff, if we give them more than their 0 hours, we're going to have to basically guarantee their average hours. Now, most of us don't have technology that can look at the historic 12-week rolling average and won't tell us, if I give this person future hours, what it could do to their retrospective average that may become a liability for me in the future. So that's where, technology is really going to have to help us.
Absolutely.
But I guess that's probably a question for Ben in terms of the practical examples you can kind of share with us around how AI can be used in a day-to-day environment for our operations, specifically, that time attendance, scheduling, rostering, compliance side of things.
I think something that really resonated with, I think Steve mentioned, you mentioned it, is sort of there's an awful lot of quite time-consuming, boring things that need to be done, and you need to get people on side. You need to, with an awful lot of technology initiatives, in the end, it doesn't come down to the technology. It comes down to the extent to which people adopt the technology. And you can have the best technology in the world, but if you can't get people to buy into it, you don't see the benefits. And I think something that aligns those interests is AI is really, really good at incredibly boring things. If you think about going back and working out reference periods and things like this, I don't think there are very many people who are relishing the task of collecting all of this data and doing this analysis and then doing all the configuration. The same goes for how TNA is for TNA. There's a lot of manual work that sits behind it, and probably the people that are doing it, that wasn't why they got into social care. I don't think it wasn't sort of like, that's not what you imagine when you get into it. But so you have these very, very skilled people who are doing things that they didn't really want to do, that are taking away from things that would be so much more value adding. And so I think that's why use cases like having TNA taken care of automatically, like sitting over HR policies and understanding if you're compliant with them, like building rosters automatically or semi-automatically or in an assisted fashion. I think these are the types of use cases where they're really powerful to get buy-in, because I think once you can show a team some early wins, once you can show somebody, this isn't something that replaces me, this isn't something that adds to my workload, this is something that means the task I dreaded anyway, I no longer have to do. And I look great in my job because that task's getting done really, really well. And it's still owned by me. It's just that I got to spend a much higher proportion of my day doing the thing that I got into social care for, not the administrative work that sits behind it. And I think that's where, you know, the scheduling, the time and attendance, things like this are very powerful. And that's where we're particularly, one of the reasons we're particularly investing in the, hey, how do you sit over all the dashboards and get out what the 5 things are? Because I'm guessing there's quite a few people on the call who've been through the process of doing a big data warehousing exercise, doing a big dashboarding exercise, getting a suite of dashboards out there, and then looking at the usage data for the dashboards and being like, hey, we would like it if people were looking at these a lot more. But people don't have time, right? Like, but they would like to, but they don't have time to sit down and look at 30 dashboards every day. And particularly in social care, there are so many things that happen which they are predictable. If you know about them in advance, you can change something. Do you have somebody with particularly high acuity care who is potentially being looked after by a combination of agency and less experienced staff? That's somewhere that the management of that shift should probably be paying a bit more attention, for example. That all existed in the data ahead of time. That can all be flagged, but somebody would need to spend hours trawling through dashboards to get there. And so I think that the types of things that are tangible that can happen today are these things where you can be a shift leader, or you can be someone and you're finding out ahead of time, hey, there are these 5 things I should be aware of, and I'll look like a superhuman afterwards because I'll catch 5 things that I wouldn't have caught otherwise. And then I look great and then I get promoted. And suddenly AI goes from being this scary thing to this thing that just makes my day better and gets me promoted and gets me a rise and this sort of thing. And I think that's why it's really important to think through that journey for the people who are going to be using it.
Absolutely, yeah. I mean, yeah, it's an asset, it's a tool to help you, and I love that, to make me look good in my job. If something can make me look better in my job, I'm down for it. I'm up for it. So, Sue, do you have any thoughts on kind of these potential new tools and systems?
Yeah. Yes, obviously our focus at the moment is very much about enhancing operational tasks and the impact on both the resident and staff. Tools such as virtual assistants, where they provide medication reminders, answering questions. But I think one of the ones that really resonates is to reduce isolation and help individuals manage independence. I've got an example of this actually, which I wanted to mention. So my dad is 90. He uses a mobile phone to FaceTime family. He uses his laptop for banking. He talks to Alexa quite a lot, especially to remind him that his laundry is ready. And that's just a few of the technology out there that, and we always think that people of a certain age can't use technology, but he's a great example of how you can. We're reviewing sensor-based monitoring and how you can detect vital signs such as change in heart rate and breathing, and smart rostering, which we have mentioned. And the one for me that really resonates is data integrity, the ability to access data, which is clear, actionable, and supports managers to make evidence-based decisions. Whilst these tools support day-to-day tasks, we need to consider very much around the security of data, because there's a lot of data there, and in the wrong hands could be a huge problem. So privacy of information, ensuring that we still meet person-centered approach, and the need to remember that AI is there to assist, not replace. So we've currently updated our security operations to manage the increase in our data.
Amazing. I think you've brought in about the in-room monitoring, so the room tech devices. I think they are absolutely fantastic examples of how we can use technology to support us to provide better care and to be alerted. I think that's great. But you also make a really important point there around kind of security of data and privacy. And I think there are understandable concerns in social care about technology replacing people, and employers wanting to know, how do we strike the right balance between automation and human care. And I think from my perspective, I think we have an increasingly acute resident profile coming through our networks and our homes currently, and we'll need more people and AI and technology as an enabler to support us to meeting the changing needs of the current resident profiles and cohorts. So I don't see AI and robotics and this room technology replacing humans. I see it really adding value and supporting us to do more of the caring, because we've got more acute people really supporting our workforce to become more effective. But you did raise a really important point there, Sue, around security and governance compliance. So I think probably question for you, Ben, is from an AI and a data perspective, what are some of the compliance and data governance considerations providers should really keep at the front of their minds when they're thinking about introducing AI type technology?
I think it's one of those things where like there can be a bit of a tendency to think of AI as this very different thing to traditional information technology. And while there's a lot of new things about it, all of the same foundations that apply to data governance in sort of IT as it has been for many years are applicable to AI. So I think the important thing is to make sure that there is a framework in place that says the goal of this framework is to allow us to achieve business objectives using AI. But of course, it still has to go through our existing security protocols, our existing data governance protocols. Of course, we need to understand what data is going where. Of course, we need to understand that this is how we're controlling access to data, how we're ensuring the right people can see it. And I think probably the biggest stumbling block here is if anything, I've been surprised how enthusiastic people are about using AI. I imagined that AI would be this thing that you kind of had to persuade people to use. And we ran some really interesting sort of polls recently in the care sector. And the problem a lot of people were grappling with was, well, everyone's already trying to use ChatGPT and things like that, because they've all got it on their phones already. And they're not the people you expect to have it. It's not like teenagers that have it on their phones. There's everybody that has it on their phones. It's like... And so they want to bring it in because they know that it can add value. They know that they have all these interesting ideas about how to add value. And where it's been problematic is where there's been no framework for that. As soon as there's a framework that says, hey, here's what you can use, here's what you can't use, here's what it looks like to use it safely, suddenly you can start to get this momentum where AI doesn't need to be a top-down thing. AI can be a bottom-up thing where people are excited about it, where people are using it. People are using it not just for sort of admin automation. I saw a wonderful example where people were using it to create stories for residents in their native language when they were struggling with English. And someone had put a framework in place that meant that they were comfortable that it could be used for that. That's a wonderful way to improve someone's experience. And that was a suggestion from the front line about how to use it. And the reason that was possible was they had a clear policy in place that said, well, these are the tools you can use for that. This is the information you're allowed to put into that. This is the information you can't put into that. So I think the important thing is be really clear about what it is you want to do, and then just follow standard IT best practices, and the same rules still apply to all of it.
That's brilliant. And I do want to come on to actually the responsible use in a moment with you, Ben, but I do want to just go back to Susan and Steve briefly first, is that you're as leaders in the care sectors, managing teams of people and aware of of your staff at Greensleeves. How can leaders like yourselves bring the teams along on this journey to kind of avoid creating that fear and resistance towards this kind of technology?
I think, to be fair, to bringing teams along on any transformation journey, it's got to start with empathy and clarity. We say that everybody embraces change, and we know that's not true. People fear change when they don't understand it, but especially when it feels imposed. So for us, the first step is creating that shared narrative, why the change is happening, what it means for them, and actually how we're going to support them, which we do by way of a pre-implementation meeting. We always do these face-to-face with home staff so that we can better explain the benefits of any new tech. An old military saying I use is hearts and minds, fits quite nicely here, although we're not salespeople by any stretch. I found that involving teams early, even in shaping a solution, builds ownership and helps reduce resistance. When people see their fingerprints on the change, they're actually more likely to champion it. And we sometimes forget that so much of the success of any tech rollouts in care depends not on the technology itself, but actually on the people who are going to be using it on that daily basis. You can have the most advanced care solution in the world, which we as system staff look at and think that's amazing, it's brilliant, it's going to ease all burdens. But if it doesn't alleviate the pressures that are faced by frontline staff or actually fit naturally into their workflows, any adoption or buy-in will stall. It's so important for the people that we're delivering these systems to, because without their feedback and insight, it simply becomes a chore. Thoughts and observations often reshape an implementation in ways that actually make it more impactful and sustainable. But ultimately, I think it's about trust. If teams trust that leadership understands their reality and is genuinely invested in making things better, not just more efficient, they'll actually walk the journey with you and not against you.
Yeah, just to add to Steve's comments, I think we also need to consider the expectation of our existing and new staff, identifying the skill level needed to manage both care delivery in conjunction with the use of AI tools or any systems to enhance, not hinder, their responsibilities. And I think what we're doing here at Greensleeves is reviewing that process around recruitment and onboarding of staff to support change by giving clear communication as to what AI solutions are and how it will work without replacing their expertise. Be open and honest about how data will be used and build trust that it's a collaboration between all of us as to the responsibility of how we use that data. Offer multiple learning styles. I think the traditional learning styles need to be far more flexible to ensure that we cover certain elements around IT and support and what the systems are there to do and the applications and the advantages from an overall perspective, and provide structured onboarding. I think it's key to retention to include the use of new systems and processes as part of that onboarding process, and also IT assessments to be included within the interview process early on in that stage. We don't want to set up our staff to fail, and I think sometimes we do that by not ensuring that they're aware of the responsibility that we're asking from them. I mean, their day-to-day role is to provide good quality care and ensure that our residents are safe, and it's combining that with also asking them to be quite technical that is the challenge.
No, that's really helpful. And I think you made the two routes that you sort of split up. I mean, we've got to take the existing staff on a journey with us to ensure success when we're integrating new systems, but we also need to make sure we're recruiting the right people going forward to kind of backfill and replace that attrition. That's great. I do want to pop back to the last question where we talked about the responsible use of AI, maybe with yourself, Ben, because it means different things to to different people with different agendas. So what does responsible use of AI actually look like and mean?
I think it ends up being a more traditional technology problem almost. I think it's sort of the, responsible use is when it's achieving business objectives in a way that aligns with how you want to work as an organization. So I think that something that's a theme throughout this, and I think through other conversations like this, is AI is not about replacing people or delegating decision making to an AI. It's not that people stop being involved. So I think responsible usage looks like using AI to augment what people can do, to augment what people are good at, but doing so in a way that means that people are still in control of it. I think that a really good mental model for AI is that when you use AI, you sort of become a manager. So in the same way, when you go from being an individual contributor to a manager, you get used to briefing somebody else on sort of how to do something, but still being responsible for the outcome of that thing that happened. And when you work with AI to an extent, it's the same mental model. It is more and more people can brief AIs that they want something done, but they still need to take ownership of that thing. They're still responsible for the outcome of that, and building business processes that mean that people are able to use AI to augment how they do things, but in which they still maintain ownership of the outcome of those things. They still retain responsibility for getting to a good place. I think that's the balance that everyone has to work out over the next few years, because as that accelerates and AI is used to augment more and more decisions, there will be more and more business processes that contain a step in them where you are leveraging an AI to do it, because people are are going to get access to this unlimited workforce that can go out and do things for them. And the impact of that will be enormous. But in the same way, when you're a manager with a team under you, you're still responsible for what happens. When you're a manager of AI agents, you're still responsible for what they go and do.
Amazing. And I think probably sticking with you on this one, Ben, I think the next 6 months looks really exciting. I'm only 6 months into my AI journey and I'm mind blown already, but I'm finding it a lot easier than I thought it was going to be. But looking ahead in the next sort of 12 to 24 months, what developments in AI are exciting you the most for the care sector? And this is probably a bit of a two-parter. Where do you think AI can make the biggest difference to the quality of care and workforce well-being?
Yeah, I mean, I think that there's a little bit of catch up going on at the moment. I think that sort of over the last 12 months, we saw there was a lot of talk about what was possible. But we haven't actually seen that many examples, right? I don't know what everyone else's LinkedIn feed looks like, but if you look at my LinkedIn, it's very easy to feel left behind because everyone's talking about how they rolled out 100 AI tools, and you kind of imagine that everybody else is fully staffed by AI-powered robots, and like you're the only one that isn't. But the reality is that like the true like enterprise-grade AI, it wasn't possible prior to like March, April of this year with like the launch of models like Opus and things like that. So the really agentic use cases, we're only going to see the first case study sort of 6 months from now. And it's going to be, there'll be the trailblazers who are part of those case studies sort of 6 months from now. And over the sort of the 12 to 24 months after that, you'll start to see more and more of this kind of repetitive admin work being taken over by agents. And then I think that where that becomes really interesting is I think we're increasingly asking a lot more from people, right? You're getting higher acuity people coming in, and you're getting not necessarily that much additional resource to sort of provide that care. So I think the ability for that to take workload off people so they can focus on that is enormous. And then on an adoption point, if AI is implemented correctly, if anything, we should have peaked on that curve of technology adoption. The hardest technology to adopt should be technology that you've already implemented now, because one of the things that should be true about AI is that it's much easier to interact with than traditional software because it's much more accommodating. It's much more flexible when you make mistakes. So we should be starting now, finally, after sort of 30 odd years, to be coming down the other side of that sort of difficulty of technology use and getting to a world where actually as new technology is added in the form of new agents, it's less and less of a change to interact with, because the way you interact with one agent and the way you interact with 10 agents behind the scenes is completely identical. You're just giving an outcome. You get used to this standard pattern of, here's the outcome I want. An agent goes and picks it up and then asks me if it needs input. And so I think the really big impact is that over the next 24 months, there'll be less and less need for people. It's weird to say this as a technologist, but I think the biggest impact is going to be that there'll be less and less need for people to think about technology day to day. You won't have to think about, oh, I'm going to log in here and have to remember what I click on, and I'm going to have to fill in this box and it has to be done in this order. You can just go back to thinking about the outcome you're trying to get for a person being cared for, and the technology will take care of what the technology needs to take care of. And I think that's sort of like, we're not getting there in the next 6 months, just to put my hands up. Like, that's going to take like some years to get to, but I do think it starts to be very, very powerful. And it's the first time it's ever been sort of realistic to say that without everybody looking at you like you're crazy. Some people will still look at you like you're crazy, but at least like, a third of the world will be like, yeah, actually that's starting to seem possible.
It's interesting because you've used the term agent a few times, so I kind of need to put that into my head, because I kind of, it's a slightly more, I'm slightly more comfortable with that than I am sort of just the AI, which is all things. So I like the agent, but also you just said technologist there, and I've never really heard of a technologist in this context before, and actually that's great, because if I go back 10 years, no one would have known what a technologist was. And yeah, I like that. And you're such an innovative individual yourself, co-founder and what have you of Sona. You are a technologist, that's you, so it's a great use of that term. Same question really to Sue and Steve, in terms of what do you think is what's most exciting you over the next sort of 12 to 24 months, and how do you think it can impact quality of care and workforce well-being?
I think what excites me is we're shifting from reactive to proactive, and I think we'll see a lot of real progress in things like predictive analysis, AI models that can flag early signs of deterioration in health or well-being based simply on patterns in care notes or sensor data. They could be transformative for prevention and early intervention, but I think one of the main differences AI will bring is where it can help to sort of tailor an individual's support simply based on preferences, history and outcomes. And of course, whatever we use with AI has been alluded to on this call, and it's got to be done ethically with transparency and trust, but the potential to enhance both the quality and efficiency in care is huge. And we've got AI powered tools hopefully that can reduce that admin burden. Natural language processing is getting better at summarising notes, generating reports and even supporting decision making, which is again freeing up carers and home staff and care staff worldwide to spend more time with people, not paperwork.
That's amazing. And Sue, what are your thoughts on that?
Yeah, I mean, what excites me is what we spoke briefly about is data and information and access to information and integration. Providing we've got this large volume of data to streamline the reporting process. And my team will always tell you that I've got this thing about dashboards. I love dashboards. And I've got this my view of the dashboard for every role that you log on in the morning, your dashboard's there, and all of this data is giving you what you need to know for that day. And I know we have got tools out there that do similar things, but I'd love to create something like that per role to support our managers, our care staff, our senior team, to be able to have that view, particularly for them, to give them the data to make informed decisions and support the role that they do on a day-to-day basis. That's my vision.
Well, I think there's going to be a very worried printing company out there somewhere that produces those to-do list pads, and that's all it says on the top. You've just put them out of business with those dashboards there, I think. But no, I think Steve's point, reactive to proactive, that's what it really feels like. And those dashboards it's like giving you your to-do list, and it's not treating you like an idiot that can't think of it for yourself. But there's so much we don't know, and if we've got this technology in our rooms, we've got this data available, it can tell us so much more information. And I know every person I know who works in care because they want to provide the best care and give the best possible end of life or the best possible life to those people living in long-term care, the best possible experience. No one comes to work thinking, how am I going to skive off my duties today within care? It just doesn't happen. So yeah, helping people to be really proactive and to provide the best care it's just wonderful. And I think we can make people live, longer, happier, healthier lives if we can do that. I'm going to come back to one last bit because there's a couple of questions in the chat I'd really like to get to, if that's okay. And I'll ask you in Sue first, if that's okay. If you could give providers just one piece of advice before they start adopting AI, what would that be? Just one piece of advice.
I think just to be careful that AI will always be a supportive tool rather than a replacement for care staff, and it should be used to enhance capabilities and not to replace human elements such as empathy, compassion and personal connection. And this will allow our care professionals to spend more quality time with the people that we support, fostering personal relationships and compassionate support.
It's lovely, actually. And Steve, thoughts?
Yeah, I'd have to echo Sue, Richard, to be fair. It's just remember that human element. AI in itself is going to be amazing. It's a fantastic tool, and the future is looking brighter and brighter with the adaptive technologies that are coming out. But I think we've just got to remember we are person-centred, and our staff are the backbone of any information we add to any system.
Amazing. And Ben, your thoughts?
I think probably just for people to keep in mind to start with the objective. There can be a little bit of a tendency, because it's very exciting at the moment, to start with sort of, AI is the solution, what's the problem? Because there are so many exciting things out there. And I think, AI is like any technical innovation. It means that there are now lots of ways technology can help with a huge range of problems that it couldn't help with before. But it's still really important to be like, hey, what's the most important thing for this business? Like, what outcomes are we aiming for here to improve, and to work backwards from that through to, and so which AI solutions can get there. Because over the next 6 to 12 months, there are going to be agentic solutions for every single problem that anybody can possibly imagine, and they're going to have very, very good sales teams, all of them, and they'll all be reaching out, everyone will be getting in touch, and there's going to be a certain level of fatigue. So that filter is going to be really important, of like, hey, what matters from a business perspective, and then what are the agentic tools that get us to that objective? Yeah, I think that would be it.
I think I'm going to take on some advice. I'll come to that in a second. But yes, I think with what Susan and Steve said around supporting, enhancing, not replicating, empathy, compassion, and personal connection need to be considered, and that's really, really important because we're in a business about care and the human element. Absolutely. You just said something that's really resonated there, though, Ben, is to start with the objective. Of what do you want? And I think Stephen Covey was said, start with the end in mind. What is it I'm actually trying to achieve? And absolutely, I have gone on that journey on our AI we've developed, thinking, oh, I can get it to do this, I can get it to do that, and I can do all these lovely, woolly things. And actually, what I started out wanting to do with it was something completely different. I still haven't delivered what I started out wanting to do, but I've gone off on all these tangents because I'm like, oh, I can do this now with it, which is really, really exciting. So thank you, because you put me back on the rails that I needed to be on. I think from my perspective, I really do want to encourage all providers to start just getting involved with AI, starting to look at it, think about it responsibly, collaboratively, join these networks, join these forums, really talk about it, talk to technologists, I love that title, like Ben, who understand it, connect with them on LinkedIn and all of the platforms that you use, and talk about these things. And because through that conversation, things happen really, really quickly. And, you know, talk to people like Sue and Steve who have got experience of implementing technologies and have started to look at how AI can transform their services. Network, talk to people, because there are solutions out there and we're all on this journey together. It doesn't matter that we compete with each other in certain services. We're all here to provide excellent care. I am just going to go to some of the questions actually here because Masho, I hope I pronounced that correct, wanted to ask you, Steve, around what digital care plans you have and how does AI sit on top of it? I believe, Breve, you mentioned that earlier.
Yeah, the care planning, care management system that we use is Nourish Care Management. And they have, although they do have a dashboard that comes along with the product, we have what's called analytics, which means we then get all of that base data, which we can then manipulate into whatever reports or information we need.
And I think there's a lot of, I'm not going to name any of them, there are a lot of technology providers out there who are quoting they're using AI. And actually, I think, Ben, you've covered that. It's not agentic AI, which is the thing we automatically think of. It's going to solve all of the problems and it's going to be creative and think about things. It's really processing behind the scenes some of the stuff. So we really need to be clear on what type of AI they're using. And I think a lot of salespeople are probably overselling the concept of AI. And actually, it's not doing what a lot of people really think it's doing at the moment. Luke's also made a really important point here. Our implementation is extremely important as we can only use the data that's input into the system. The output's only as good as the input. I think that's a really important observation and absolutely correct. Will is also asking a question to you, Ben, actually. How powerful do you think AI can be within social care? What does capability look like in 5 years' time? Now, gosh, we talked about this briefly yesterday, didn't we? So, yeah, I really want to hear about that, because 5 years in today's terms is 50 years in old money when you're born in 1971 like me. So what are your thoughts on 5 years' time, Ben?
Oh, there's nothing quite like making a prediction in this space when it's being recorded. So I can be quoted on this. That's wonderful. I mean, I think it doesn't look like the models are going to stop getting more powerful. Like people keep predicting that they will, and then it doesn't happen. So it looks like there's a fair bit to go there, and we haven't really scratched the surface in terms of the value it can actually add, just with the current capabilities. So if models stopped getting better tomorrow, we'd have a good 5 years of progress left just with what the value we haven't exploited from them. So I think it's very reasonable to believe that sort of 5 years from now, the idea of sort of like the frontline staff thinking about administrative tasks, I think that just won't be something that happens anymore. You won't have people thinking about oh, I need to go and organize this roster, or I need to write this thing up. I think like all of those things will have gotten to the point where it's just something we look back on and remember when that used to be something you kind of did manually, in the same way like I look back on walking around London and I used to print out maps and wander around, because the only way to get around, like I used to walk around with an A to Z, and that's just a thing you don't do anymore, right? You put it into your phone and it tells you how to get there. So I think administrative tasks will go that way, and then the big limiting factor will become robotics, which we haven't really talked about, because AI will very quickly be able to take over any tasks we want that are predominantly about manipulating words. or manipulating sort of information in systems, but it still can't really reach into the physical world and help us with tasks there. And so the thing that nobody really has a good answer to is sort of what trajectory is that going to take, and at what point will it be able to expand more into the physical world, and to what extent do we want it to as well. And so that bit I definitely wouldn't dare make a prediction on, but I think that those are kind of the two big variables.
Yeah, and the shelf life of some of the technology, because it's evolving at such a pace, some technology can become redundant quite quickly as it's replaced by even more advanced technology is another consideration. I think the robotics is definitely a side. As I was explaining, I was in an airport lounge only this weekend, and I had a robot come and take my empty plate away, which is fantastic. And seeing these hoovers that can clean floors, provided they're not a trip hazard for residents. We've seen air particulate devices that are looking at picking up viruses in air particles, which are not on the market yet, but they're there. We've got a piece of kit I saw only this week last week about taking blood tests, and it can diagnose 50 different blood tests within 10 minutes that you would normally take several weeks to do, several days to do with a GP. So the tech, the robotics, and that is really becoming, at our sort of at the forefront of our feet, being able to adopt very quickly. Lizzie also puts a question in there around, are you all using dedicated software with AI features? Are you using the likes of Copilot, GPT for tasks too? Lizzie uses Copilot for writing letters and things, and wondering what else is available. Also saying here that they use a free version of Copilot rather than the very expensive licensed version, and it's great for doing first drafts of most things, but struggling to get their managers from operations to see how they could use it in their roles. Does anyone have any thoughts on those sort of off-the-shelf products that you can get and how they can be used within the operations?
I mean, we've just recently introduced Copilot, and I mean, we've had a huge change from Citrix to SharePoint. So SharePoint's given us far more flexibility from a connectivity perspective and as a communication tool, and now introduced Copilot, but always looking at other options.
Ben, any thoughts?
Yeah, I think I'd maybe draw the line between the sort of generative and the agentic piece. So with, I think, things like sort of Copilot and the GPTs and this sort of thing, they, where it's like we would like sort of textual output generated based on some input data, I think like there are lots of use cases there, and I think like sort of letter writing and this sort of thing are good examples of that. I think then you have the agentic piece, and the challenge you have there with the off-the-shelf tools is, in order to take advantage of something that can plan and reason and work through, it needs to have some level of autonomy. So an example I use a lot is like, if anyone has some spare time and goes on YouTube, look for the people that turned 1990s Ford Fiestas into self-driving cars. It's an amazing process to watch. They dismantle the whole thing and then put motors everywhere and this sort of thing, right? Like, and it's brilliant, but the thing you get at the end doesn't look like a Tesla. But like, to make something self-driving, you have to put sensors and actuators on every single component. So you take every component apart and put it back together again. And if you want true agentic AI, you need something that can look up data all over your organization, and then ideally can sort of prod things and explore things and this sort of thing. And that's what's a bit trickier with the sort of the likes of the Copilots and the ChatGPT and that sort of thing. And so there isn't yet I don't know that there won't be a good answer, but there isn't yet necessarily a great answer for how those platforms make that jump into agentic. Yeah, that may change, but as in that could change tomorrow morning. But at the moment, there isn't a good answer to that.
Yeah, and I think it's the next 6 months with agentic that's really the one to watch. That's where we're going to see the real transformation. I saw a provider only a few weeks ago, 25th September, I think it was, who got something called Magic Notes, and it's just an AI that's focused on, designed by social workers, and it's used in the care system to basically, we can have a conversation when we're doing care planning. And as long as I put my care planning form into the system, it will generate the notes from the meeting, meaning I can be really present in the meeting, and it'll present the notes back to me in a format that matches my care plan. So it's not writing a care plan for me, it's just putting it in the boxes as I go through it. And I think that's the type of really helpful way to use it. I use AI, record most of my meetings on my phone now. I convert that into text and make some minutes and action points. So I've got my bullet points to stop me writing lots of things down all the time, to kind of just make me more in present when I'm involved in activities. I think Donna says, tell us ways that you are using AI. We've covered some of that. Stephen, Susan, what systems do you use for inquiries and billing?
I'll pick that one up. So we are in partnership with Found. So Found are currently, we're managing our billing through Found. We had quite, as I mentioned earlier, an aggressive implementation last year for several reasons. And one was the replacement of our finance management system together with our billing solution. And we worked collaboratively with Found to develop the billing solution specifically for us here at Greensleeves, which was really successful. We're now incorporated this CRM solution and the integration between Found and Nourish to draw the line that have that full integration of the resident journey. Again, here at Greensleeves, that they'll know about my resident journey and my employee journey that I'm always going on about, and it's that streamline process all the way through that's automated right to output of the reporting requirement. So yeah, we're using Found.
Look, I'm going to close the questions now. There is one person who's just dropped a question. I'm going to give a shout out to Joe Drury, because I worked with Joe many years ago, and I haven't heard from him for a very long time. So it's really nice to see his name pop up on my screen. Joe says, I'm keen to ensure that our recruitment onboarding process is both inclusive and effectively assesses candidates' values along with their skills and experience, particularly for frontline roles such as care assistants and support workers. What AI tools or approaches could support this objective? I know, Ben, as a technologist, you're horizon scanning. Have you got any suggestions on technologies that might help Joe?
I think one of the bits that's progressed more quickly than I expected, and is that we're starting to do a lot with, is the voice side of it. So in terms of how you conduct interviews makes a huge amount of difference to interviews. One of those things, we ask an awful lot of people to do them. But it's actually really hard to train someone to conduct a good interview and to consistently apply how they question things and this sort of thing. And so I think like the voice tech there, like one angle is conducting the initial interviews, because AI can conduct interviews as well as bias, and the other is having AI's sort of co-pilot interviews. And be there and being able to interject, or being able to even provide sort of a real-time view to the person interviewing around where they perhaps ought to redirect, or where perhaps they focus more on one area with this candidate than they have another. So I think like voice is going to mean that some of the use cases that a year ago I was saying they were 2 years out may only be a few months out, because you are getting to this weird place very quickly where you can have a frighteningly natural conversation with a voice AI. And that extends out of just talent attraction. It extends, I think, performance management is an extremely interesting use case for that as well, where it's sort of like, one of the highest leverage things we could be doing is developing our existing people, because we have so many of them. But performance management is really hard to do well. And I think that's something where sort of voice AI can help.
I love the idea of performance measurement, because that really does take the human side out of it. I'll be really interested to think how HR might use that. But you made me chuckle a little bit, because we all hate chatbots, but actually that interview with that voice learning AI and the technology there is actually meaning that chatbots can become what we really wanted them to become originally when they were created. So that's great. I'm going to close the session, but there's one question I'm just going to put to you, Ben, because if a provider said to you, AI isn't for us yet, what would be the one piece of advice that you would give them to think differently?
I think where I've seen people say AI isn't for us, I think it's actually been really fair. It's sort of been like, an organization it can absorb a given amount of change at any given time. And I think when people talk about AI, they imagine something very big. And so I think probably the most common thing I end up saying is like, start with something boring, start with something small and boring. Just to get used to how it's going to work, because there is going to be this divide that opens up over the next few years of organizations that embrace it and they don't, and organizations who don't, and it is going to be hard for the ones that don't to keep up with the ones that do. But you don't have to start with like an organizational-wide transformation project that rolls out AI everywhere. You can start with something that rolls out a small, simple use case to a small group of people to get a feel for what it's like to do it. And that's a much better way of doing it. Try something simple, which is sort of low risk, and get some engagement, and then work out from there. Or you might do that and say, actually, no, we're now really sure it's not for us. But it's probably a bit dangerous to say that without having tried sort of something small and boring.
Thank you.
Small and boring seems like a weird note to end on, but
well, I am going to end it there. But thank you to yourself, Ben, Sue, and Steve. It's been a fantastic event to have the pleasure of hosting, and a huge thank you for Greensleeves for stepping forward and really sharing your experiences with us, because I've gained a huge amount from that. And Ben, if people aren't following you online, they absolutely should be following you, because you've got a huge amount of insight. You are an incredibly talented individual who's doing some amazing stuff, and I've learned a huge amount today, and I shall certainly be wanting to tap into your wealth of knowledge and experience over the coming 6 months. And maybe we can have another one in a few months' time to kind of just see, well, okay, what's happened in the next 3 months, because that's 2 years in normal lifetimes. So maybe we can all get together again very soon. Thank you all, everybody. We'll send a recording out, and we'll hopefully speak to you all very soon.
Thanks.
Thank
you.
Thanks,
very
Ben.
much. Bye.
Bye-bye.
Sue, Ben, and Steve, would you like to stay on?
Thank you.
Are you okay to stay on for a second?